So now we will be having a look at reading part B, and today's material we have not done it. This is the latest material, so we will be having a look at part B. Since you all of you are familiar with the structure of reading part B, I will not be explaining it. If any one of you are new to OET and you would like to get orientation on reading part B, make sure to contact Gia ma'am. She has the orientation video in detail. I have given a recorded session on reading part B. Everything, every single thing that you need to know about reading as a test, it is there in the orientation video. If you need access, make sure to contact Gia ma'am, which is our administrator. Okay, all right. So I'm moving on to directly to the part B. So let's have a look at. Okay, here we go. All right. So when it comes to reading part B, you will be answering 6 questions and you will be reading 6 different extracts. And your questions are 3 option MCQs. So what is the best way to approach these questions? Okay. So the best way is you first read the question, then read the text, then have a look at the option. That is the best way. And that is something that we will be doing today. Question, text, options. Okay, so otherwise another approach that you can take is you can start with the text, then the question, finally look at the option. That method also works with practice. Text, question, option. I would not be using that, but that's also fine. If you're comfortable with this approaching part B questions like this, that's completely fine. However, there is another method which is very popular out there, and which I would not recommend that you use. That is, read the question, the option, then the text. No, reading the option before the text will again confuse you. So make sure that you either go with the first approach or the second approach, not with the third approach. Okay, so take a second, go through this. And this is exactly what the first approach is, the one that we will be having a look at today. Okay, all right. So let's start with today's extract. Here we go. All right. Okay, okay. This is our first question. Let me just zoom out so it's visible. Okay, all right. So, right. Smita, can you unmute yourself and read the first question for me, please?
Yes, ma'am. Good evening, ma'am.
Good evening, Smita.
What point do the guidelines make about allocating powered wheelchairs?
I want all of you to read the question. What point do the guidelines make about allocating powered wheelchairs? Okay, all right. One second. Let me just say. Okay. So here we know from the question itself, we know we are going to read guidelines, and the guidelines is about allocating. What do you mean by allocating? What do you mean by allocating? What is the meaning of the word allocate? When you allocate some work to someone, what are we doing? Allocate. Giving or assigning. When you assign or give something, okay, that's what we call as allocating. Okay, so all of you read the question and tell me what exactly have they asked us to find out. The question is, what point do the guidelines make about allocating powered wheelchairs? So what exactly should we find out here? Saubhagya, Jyoti, Shinu, others, what do we need to find out here? What have they asked us to find out? Look at the question.
What point?
Point made about
allocating powered wheelchairs.
Allocating powered wheelchairs. So they are the topic is powered wheelchairs. So we need to find out what exact point is made about allocating, giving, or assigning these wheelchairs. What exact point is made about allocating powered wheelchairs? That's what we need to figure out. All of you take a second. Look at the question. Look at the interpretations. Do not look at the options now. Okay, all right. Now let's take 55 seconds and all of you read the paragraph, read the extract. This is your extract. Please go through it. All of you. Okay, Smita, can you unmute yourself and read the heading and read till here for me, please?
Wheelchair selection guidelines.
Till here, till here.
Mechanisms in wheelchairs which are used to provide seat tilt, seat lift, and backrest recline functions can pose an entrapment threat, in particular to fingers, toes, and especially to inquisitive children.
Okay, inquisitive children. Okay, let's have a look at the sentence. So the extract is about wheelchair selection guidelines. Okay, selecting wheelchair. That's what the extract is all about. So in the first sentence, it says that mechanisms in wheelchairs which are used to, so the wheelchairs have different mechanisms such as, tilting the seat or lifting the seat or reclining the backrest. All these functions of wheelchairs can be an entrapment threat, can entrap our fingers, our toes, or can be dangerous to kids who are inquisitive. Inquisitive means who are curious. Okay, so all of you take a second. According to the guidelines, the wheelchairs have mechanisms that tilt the seat. Tilt means, to push the seat to one side. Okay, so to tilt the seat or to lift the seat or to recline, to push the backrest, all these functions are there. All these mechanisms are there. These mechanisms in wheelchairs can be an entrapment threat. Can have a feature of trapping a person's finger, toes, or anything like that. And it is also a threat to inquisitive children. Inquisitive means curious children. Okay, all right, Smita, continue reading till here. Till here.
Yes, ma'am. Trapping points can also be created when adjustable components such as reclining backrest and moved relative to fixed components such as armrest. During the evaluation process, consideration should be given to the user's physical abilities. Example, eyesight and postural control, and the intended setting for the wheelchair, along with the manufacturer's guidance to reduce trapping hazards.
Okay, so I want all of you to focus on the first sentence here. Okay, trapping points. So they already told that, some wheelchairs can have entrapment threats where they can trap our fingers, toes, or things like that. So points where that trapping can happen, that can also be, such points gets created when adjustable components, adjustable parts of the wheelchair, such as reclining backrest, are moved relative to. So when you move something relative to fixed components, what does that mean? Okay, relative. So when you move the adjustable components relative to fixed components, that means along with. Okay, or others are together. So based on there are certain parts of the wheelchair which is fixed. According to those parts, if you're moving the adjustable parts, then there forms a trapping point. Okay, so armrest and everything we cannot move, but we can move the backrest. So when you move these backrest and everything according to these non-movable parts of the wheelchair, what happens? Trapping points get created. And when you're evaluating your patients, you should consider whether the user has any. You should take into consideration the abilities of the person, like eyesight, how they are able to control their posture, and in what setting they will be using the wheelchair, along with the manufacturer's guidance. So when you are evaluating a patient for whether there's suitability to use a wheelchair, you need to check their physical abilities, in what setting they will be using the wheelchair. Also, you need to consider the guidance given by the manufacturer of the wheelchair. All this will help to reduce trapping hazards, dangers related to trapping. So according to the extract, there are different mechanisms in a wheelchair, such as changing the seat, lifting the seat, reclining the backrest, all those things. All those can be an entrapment threat. So, and these trapping threats or trapping points gets created when you try to move fixed components along with adjustable components. So while you're evaluating a patient, you need to consider their physical ability, the intended setting of a wheelchair, and what the manufacturer has told about the wheelchair. So all this will help us to reduce trapping hazards. Okay, all of you are with me so far? Is this clear? Nivya, Asma, Jyoti, Saubhagya, Smita, Shinu, Blessy, others. So far, is it clear?
Yes, ma'am.
Yes.
Okay, all right.
Yes, ma'am.
And I want you to later on read this sentence, because here you need to know what relative means. When you move something relative, move one thing in relation with another, that means in order to match with that thing, you're moving this one. Okay, so you need to look at that sentence later. Continuing here. Okay, Smita, now can you read till the end for me, please? Starting from here. Yes, Smita. Yeah. Make sure to unmute yourself so I can hear you, Smita.
Yes, ma'am. People who are visually impaired or who have severe epilepsy may be unable to use powered wheelchairs safely. However, the benefits, specific situation, diagnosis and prognosis should be taken into account so that end users who could in fact operate the powered wheelchair safely are not denied.
Okay, let's have a look at this sentence. People who are visually impaired, people who cannot see or who have a severe case of epilepsy, will not be may not be able to use electric wheelchairs safely. However, the benefits, the advantages, the specific individual situation, and the diagnosis and prognosis of a person should be taken into account, so that end users means somebody who will need that particular, who will be using that thing. So people who needs to use it will be so that end users who could in fact operate the wheelchair safely are not denied. So you cannot when it comes to visually impaired people or who have severe epilepsy, they might not be able to use wheelchairs, powered wheelchairs. Even though that is the case, the benefits of the wheelchair, the patient's specific situation, their diagnosis, prognosis, or end users, all these things, the people who are going to use, all the benefits for them, their specific situation, their diagnosis, their prognosis, all should be taken into consideration. So for people who can use who are able to operate the wheelchair safely, so we don't deny them. So we don't restrict them from using it, or we allow them to use it. So when you deny something, you don't give it to them. So they are saying, even though these two problems, visual impairment and severe epilepsy is a problem, and such people may not be able to use wheelchairs, depending upon that users, whether they have the ability to use it safely, their benefits, their situation, their diagnosis, prognosis, all should be considered and given. And if they can use it safely, then you shouldn't deny that. Okay, so all of you take a second, go through everything. Very interesting extract. Go through everything. Wheelchairs have specific mechanism that can pose us entrapment threat by trapping our fingers, toes, and it can be even a threat to inquisitive, curious children. And when you move fixed parts of the wheelchair along with the adjustable parts, trapping points gets created. And when you're evaluating, you need to take into consideration the person's user's physical ability and the setting in which they will be using the wheelchair, the guidance given by the manufacturer. All this will help to reduce trapping hazards. Also, people who are visually impaired or who have a severe case of epilepsy may be unable to use the wheelchair safely. Even though that is the case, for any user, if they can use in order to ensure that we don't deny wheelchairs to people who can use it safely, you need to take the benefits of that wheelchair for them into consideration, their situation, their diagnosis, their prognosis, all these should be taken into consideration. So people who are able to use it safely are not denied that, are not denied of that opportunity. Okay, so Blessing, Nivya, Asma, Jose, Jyoti, Saubhagya, Shinu, Smita, and others, are you clear? Go through this. Go through this. Okay, now let's have a look at our options. Okay, Smita, can you read the options one by one for me, please?
Patients with progressive conditions should be prioritized.
Anywhere in the extract, have they mentioned patients with progressive, advancing conditions should be given importance? Did they say that anywhere?
No, ma'am.
No. So Bhagya, Jyoti, Jose, Shinu, Nivya, others, have they said that anywhere in the extract?
No, ma'am.
No. So we can
No,
reject
ma'am.
that. It's not given. They have talked about visually impaired. They've talked about severe epilepsy, but they have not said that, patients who have progressive conditions should be prioritized. That's not said. Okay. All right. Next option, Smita.
Option B, extra care should be taken when assessing their suitability for a child.
Have they talked about their suitability? What does their refer to here? Their suitability. Suitability of what? Suitability of
Wheelchair.
wheelchairs. So have they said that when you are assessing a child's suitability for a wheelchair, you need to take extra care? Have they said that?
No.
No, they have said kids who are curious, the wheelchairs, the mechanisms in a wheelchair can be an entrapment threat for kids who are curious. They have never said assessing the suitability of a child for a wheelchair. That is not said. All if you take a second, read the option, understand why we rejected it. Just because child is mentioned here and here, it doesn't make the answer be your option, because here they have talked about curious children for wheelchairs becoming entrapment for curious children. They have not talked about suitability of using a wheelchair and taking extra care while assessing kids. Have they talked about that? Come on, tell me.
No, ma'am.
No. So of course answer is C. Smita, can you read the answer for me, please?
Yes, ma'am. Every effort should be made to offer them to the widest possible range of users.
Every effort, you need to take all the effort that you can to you need to make all the effort that you need to make to offer them. Them here again refers to wheelchairs. Offer wheelchairs to the widest possible range of users. What do we mean by that? Widest possible range of users means whoever you can give wheelchair, when you in order to give them that wheelchair, you need to take all the effort. Why do you, option C is correct, right? Tell me why. I'm showing the extract. From the extract, tell me what confirms that option C is the best option. What sentence from here confirms that option C is the answer? By elimination, we know A is wrong, B is wrong. My question is, C is the answer. What makes C the best option? Tell me that.
In that it's mentioned consideration should be given to the users.
Users for what? The benefits. You need to consider the benefits, the specific situation, diagnosis, prognosis. You need to take all these things into consideration to ensure that we don't deny anybody wheelchairs. So that means you need to take every effort to ensure that people who needs a wheelchair gets it. Okay, who all need it. The possible range of widest, as many as people as you can, they are not denied, and in order to ensure that, you need to make every effort. What is the effort? Consider benefits, specific situation, diagnosis, prognosis. Blessy, Nivya, Asma, Shinu, Danya, Jose, Jyoti, Sabhakya, Smita, and others, are you clear why C is the best option?
Yes, ma'am. Clear, ma'am.
Okay.
Yes, ma'am.
This is the latest material. Very good question. Very good extract. I want you to go through it later. Go through this later. Okay. Moving on to the second question, which is again a very good one. Let's have a look at the second question. Jyoti, can you read the second question for me, please? This one.
The memo about animal euthanasia advises veterinary surgeons on.
I want all of you to read the question. The memo, so we know we are going to read a memo. The memo about animal euthanasia. Euthanasia is mercy killing, okay? Animal euthanasia advises veterinary surgeons on. So what do we need to figure out? Pause and read and think about what exactly have they asked us to find out here. We are going to read a memo, that's there. But what do we need to find? Advice. Advice given to whom, Saubhagya?
Veterinary surgeon.
Yes. About
animal mercy killing.
Mercy killing. Yes. Advice given to, so after we read, we need to figure out advice given to veterinary surgeons. Veterinary surgeons. I'm just writing vet surgeons. Veterinary surgeons on animal euthanasia. So what exact advice is given to veterinary surgeons on animal euthanasia? Animal euthanasia. Okay, euthanasia. It's pronounced as euthanasia. Okay, euthanasia. That means mercy killing. All of you take a second, go through the question. So this is an incomplete question. Look at the interpretation. Animal euthanasia, a memo about animal euthanasia advises. veterinary surgeons on what? What advice is given to veterinary surgeons? That's what we need to figure out. Okay? All right. Take 55 seconds, read the extract. All of you read the extract. This is the extract. Take 55 seconds and go through it. All right. Okay. Jyoti, can you read the heading and the first sentence for me, please? The whole thing. First
Memo surgeon euthanasia.
Continue.
Okay. The primary purpose of euthanasia is relieve the suffering of an animal. Before a decision is made, many factors should be assessed, including extent and nature of the disease or injuries, prognosis and potential quality of life after treatment, likelihood of successful treatment, animal's age and health status, or even the owner is able to pay to private treatment.
Okay, I want all of you to focus here. So this memo is for veterinary surgeons and it's about euthanasia. And the first sentence says that the main purpose of euthanasia is to relieve the suffering, is to take away the suffering of an animal, or to prevent the suffering of an animal. Before you make the decision for euthanasia, you need many factors needs to be assessed, many factors needs to be evaluated, such as the extent. So remember the meaning of this word. This is very common in B and C part of your reading and listening. Extent of something, the degree, to what extent, to what degree something is there. So before you make the decision for euthanasia, you need to take into consideration the extent and nature of the animal's disease or injury, the prognosis of those conditions, and the after the patient receives some kind of treatment, what will be the possible quality of life they receive. And along with that, you need to consider possibility of the successful treatment. Whether if you start a treatment, will the treatment be successful? The age of the animal and health status of the animal. Also, whether the owner of that animal has the ability to pay for private treatment. So euthanasia is the main purpose is to relieve the suffering of an animal. And before you make that decision, you need to take into consideration all these factors. Okay, the extent of the disease or injuries, the prognosis of the disease or injuries, how, if you start a treatment, how will be the quality of life after the treatment is over, and whether there is a possibility for a successful treatment, the age of the animal, the health status, and whether the owner of that animal has the ability to pay for the treatment. Okay, all right. Jyoti, till here. Can you read till here for me, please? Yeah.
On occasion, veterinary surgeon may need to make difficult decisions.
Okay. Okay, Jyoti.
Example,
Okay, Jyoti, your voice is breaking, so I'm mute. Your voice is breaking. Hello, Jyoti, can you unmute yourself and speak again? Hello. Okay. Okay.
Restriction on an animal which in their
Okay, all right. Jyoti,
clinical and professional judgment is unnecessary. Okay, ma'am.
Okay, your voice is
Yes.
breaking. Your voice is breaking.
On occasion, for example, they may receive a request for the restriction on an. Okay, ma'am. I'm sorry.
And that's okay. That's completely fine.
I'm audible.
Now you're audible. Okay.
Yes.
So I'll explain it. Then you can read the next. So on occasion, that means sometimes veterinary surgeons may need to make difficult decisions. There are occasions where, as a veterinary surgeon, they need to make difficult decisions. For example, the veterinary surgeons may receive a request for the destruction of an animal, which in their clinical and professional judgment is unnecessary. So even though it's not needed, the surgeons may be asked to do euthanasia or destroy the animal, even though that's not needed. And as there are no health or welfare reasons, there is no problem with the animal's health, there is no problem with the animal's welfare. Even then, at times, they will receive a request to destruct that animal. That means carry out euthanasia. So they are talking about how at times the veterinary surgeon needs to make difficult decisions. Okay, Jyoti, can you read from here till here now?
Yes, ma'am. Conversely, an owner may wish to keep an animal alive in circumstances where euthanasia would be the kindest course of action. In such cases, the extreme sensitivity of the situation should be recognized and sympathetic efforts made to recommend alternative sources and of advice, such as a second veterinary opinion.
Okay, so they said that on occasion, veterinary surgeons may need to make difficult decisions. So, for example, they sometimes, even though the animal is the health of and welfare of the animal is okay, they may be asked to conduct a euthanasia. Or, on the other hand, the owner of that animal may want to keep the animal alive, even though giving a euthanasia would be carrying out euthanasia would be the kindest thing to do. Even that means mercy killing would be the choice at the time, even though that is the case, the owner might not agree to it. So in such cases, you need to understand that this is a sensitive, extremely sensitive situation, extremely delicate situation. Recognize that, and the surgeons need to make efforts to recommend other sources of advice, such as, okay, you can ask them to go for a second opinion. Okay, because this is a very delicate situation, killing that animal, the owner might not agree to it. So you need to be sympathetic, and you can give other advice, and you can also ask them to take a second veterinary opinion. Okay, so all of you take a second, go through everything here. So the main purpose is to relieve the suffering of an animal. Before they make a decision, they need to take a lot of factors into consideration. Sometimes when they make decisions, it might not be easy. Sometimes some people will ask them to carry out euthanasia even though the animal is okay. On the other hand, sometimes the owner, even though euthanasia would be the kindest choice, that would be the appropriate kind thing to do, the owner might not be ready. At that time, they should be very sympathetic, and they should give some alternative advice, such as going for a second opinion. Okay, so Blessy, Nivya, Asma, Shinu, Saina, Jose, Danya, Jyoti, Saubhagya, Smita, are you clear with the extract?
Yes, ma'am.
Okay, okay. So Jyoti, this is an incomplete question. So can you read each option with the question for me, please?
The memo about animal euthanasia advises veterinary surgeon on how to recognize when an owner is neglectful.
Have they talked about, what do you mean by neglectful? What is
refusing to do something?
Not refusing to do something. Okay, almost there. That something is not taking care. Okay, when neglectful is when somebody does not care. Okay, does not care. Okay, that's what. So refusing to care, that's what neglectful is. So have they talked in the memo? Have they mentioned anywhere that is the memo advising veterinary surgeons on how to recognize, identify when the owner of an animal is neglectful, is not taking care of that animal? Is that what the advice is given about that? Is that the advice being given to the veterinary surgeons, that they on how to recognize, how can they identify when the owner of an animal is not taking care of that animal? What do you guys think? Come on, tell me.
No.
No. Okay, neglectful does not mean refuses. Neglectful means refuse to take care. When you're neglectful of someone or some animal, that means we are not taking care of it properly. So no way, they have talked about owners not wanting to kill animals, but they have not talked about owners being neglectful. So A is not your answer. Next option, Jyoti.
The memo about animal euthanasia advises veterinary surgeon on how best to support owners after the procedure.
Have they talked about supporting the owners after the procedure? Come on, tell me, after the procedure.
No, ma'am.
No. Okay, so of course that automatically makes elimination, makes C as your answer. But can you read the option with the question for me, Jyoti?
Yes, ma'am. The memo about animal euthanasia advises veterinary surgeon on what to do if owners wishes conflict with their opinion.
Conflict means goes against or does not agree. So if owner's wishes of an owner does not agree or goes against with their opinion, with the veterinary surgeon's opinion, right? Last sentence, right? They can ask for second opinion. See the option, all of you. When I say something conflicts something else, it goes against. Okay. Okay. So what to do? What should the memo gives advice to veterinary surgeons on what to do, what should they do if wishes of the owner goes against their opinion, the surgeon's opinion, right? The last sentence is right. Extreme sensitivity, sympathetic efforts made to recommend alternative source of advice, such as going for a second veterinary opinion. So that sentence makes see your answer. So all of you take a second, go through the question, go through the extract, look at the option and understand why we rejected A, why we rejected B, and what makes C the best option. All of you. All of you. Okay? All right. So this is pretty straightforward. So I'm moving on to the next question. Cicely, can you unmute yourself and read the third question for me, please? Cicely? Okay, all right, that's fine. Saubhagya, no issues. Saubhagya, can you read the third question for me, please?
Okay, ma'am. The memo states that patients presenting with influenza symptoms should be.
Okay, let me tell you one thing. I think last week or the week prior when we were discussing, I talked about handling an incomplete question that ends with should. Now we have a question that ends with should be. Okay, so whenever they talk about a subject can be a person or a thing. So a subject, then they mention should be, not should be. Then you can interpret that question by given what. Given what. So if the subject is a patient, okay, patient, then if it should be, then you can interpret it by treated how. Okay. All of you take a second, go through it. So whenever you have a question, incomplete question that does not end in a question mark, and it ends with should be, and before should be there is a subject, or if the subject is the patient, then you can interpret, if there is a subject, then it is should be, you can interpret by using the question phrase given what, or if it's the patient, then should be, then you can interpret that question with treated how. All of you. So now look at the question. The memo states that that patients, so patients are our subject, patients presenting with influenza symptoms should be. So my interpretation would be should be treated how. All of you take a second, look at the question, look at the interpretation. All of you. Last week we discussed should, not should be. We were adding the should be. B is already in the question. So so we have a subject here. The subject is patient. So I used treated how. So we need to figure out how should the patients presenting with influenza symptoms be treated. Okay, Jyoti, Saina, Jose, Danya, Shinu, Asma, Blessy, Nivya, Cicely, and others. Are you clear with the question? Go through it. Clear how you should interpret the question. All of you. Okay, perfect. So remember, last week it was should. This week it is should be. Okay, all right. Now take 55 seconds, read the extract, all of you. Okay, all right. So Bhagya, can you read the first sentence for me, please?
Okay, ma'am. Memo to all family doctors, influenza diagnosis.
Okay, continue.
This is a reminder that influenza must be considered in patients presenting with compatible symptoms and verified rapidly by requesting appropriate laboratory investigations.
So this memo is to all family doctors and it's about diagnosis of influenza. And the first sentence says that this is a reminder. The memo is reminding that influenza must be considered in patients, considered in patients who present with not compatible. Compatible is different. It's compatible. Compatible means matching. When something matches with something, that's called compatible. So compatible symptoms, and so if a patient presents with symptoms that matches with influenza, then and verified rapidly. Such patients must be verified rapidly, quickly, by requesting for appropriate lab investigations, laboratory investigations. So this is a reminder to the family doctors and asking them to verify and quickly go for lab tests if any patients present with symptoms that match influenza. Okay, next sentence, Sobhagya.
It is equally important that empirical antiviral therapy is commenced rapidly before influenza is identified, as delays are associated with increased mortality.
You, as a OET student, you need to know mortality means death rates. Okay, you need to know that. It's very common vocab in part C as well as part B. So they are saying you need to send for quick laboratory investigations. At the same time, it's also important that empirical antiviral therapy. Okay, empirical means something that is confirmed through experiments. So empirical antiviral therapy is started quickly before influenza is identified. So before even the identification is done, even before that, it's important that you start antiviral therapy, because if you delay it, that can lead to increased rate of increased death rates. Okay, so all of you go through the first paragraph. When someone comes with the symptoms matching with influenza, quickly send for laboratory examination. At the same time, before even influenza is, before you identify the condition itself, you need to start treatment using antiviral therapy, because delays can lead to death. Okay, so Bhagya, now till here.
Seasonal influenza. Patients with severe complicated influenza often require admission to critical care units at the time of hospitalization or soon after admission. Influenza may be missed as a potential diagnosis in individuals who have traveled recently, have unexplained severe acute respiratory infections, or out of season, atypical or extrapulmonary presentations.
Okay, and second, the next two lines talk about seasonal influenza. They say patients who have severe complicated influenza often require admission to critical care units at the time of hospitalization or soon after. So as soon as the patient is admitted, with the admission itself, the patients who have severe or complicated cases of the disease needs to be admitted to the critical care units, either after you admit them or soon after you admit them, or during admission itself. Okay, then sometimes you may miss the diagnosis of influenza because as a possible diagnosis, especially in individuals who might have gone out of the country, or that means traveled recently, or have unexplained acute respiratory infections, or out of season, atypical or extra pulmonary presentation. So because of all these things, sometimes you may miss the diagnosis. Okay, so Bhagya, last sentence still here.
In addition to consequences for the infected individual, failure to consider influenza and implement appropriate infection prevention and control measures may increase the risk of in-hospital transmission and outbreaks within critical care.
So if you fail to identify influenza and start appropriate prevention measures and control measures, it not only puts the individual infected individual at risk, it also may increase the risk of transmission, in hospital transmission, and can lead to outbreaks within the critical care unit. Okay, so this is to this entire memo reminds family doctors that patients who come with matching symptom need to be rapidly sent for laboratory investigations, and at the same time, before you identify the disease itself, you need to start the treatment. And sometimes people who have severe and complicated influenza, they may need to immediately send to critical care unit at the time of admission or soon after admission. And sometimes you may miss influenza diagnosis, maybe because patient might have traveled, or they have out of season and severe unexplained respiratory infections or other pulmonary presentations. Other than these, if you fail to consider the condition and start appropriate treatment and other measures, it may not only put the patient at risk, at the same time it increases in hospital transmission and may lead to an outbreak in the critical care unit. Okay, all right, let's have a look at the options. So Bhagya, can you read each option with the question for me, please?
Okay, ma'am. The memo states that patients presenting with influenza symptoms should be started on medication before the illness is confirmed.
What do you guys think about option A? Can it be the answer?
Maybe.
Maybe, right? It's mentioned, but let's consider the other option as well. Saubhagya, other options, please. Can you read that?
The memo states that patients presenting with influenza symptoms should be placed in isolation to protect other patients.
Have they talked about isolating the patient anywhere? Saina, Danya, Jose, have they talked about isolation?
No.
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 No. They have talked about critical care units, but not isolation. Next option, Saubhagya.
The memo states that patients presenting with influenza symptoms should be examined for other high risk conditions.
Have they told that? Other high risk conditions? No, they've talked about, you may miss the diagnosis, but they have not talked about other high risk, examining patients for other high risk condition. No. So, of course, option A is the answer. You know why it is. This is the sentence. The sentence. It is important to start antiviral therapy before influenza is identified. So, A is the answer. Okay. Quickly go through it and make sure that you remember this. Remember this point should be. Okay, if there is patient, then you can say treated how or dealt how. Both are correct. Okay, please go through this as well, all of you. Okay, let's move on to the fourth question for today. Here we go. All right. Okay. Right. Okay. All right. Blessy, if you don't mind, can you read the question for me, please? This one.
The guideline about the use of gloves informs the reader about.
The guideline, we are going to read a guideline which is about the use of gloves informs the reader about. So what do we need to find out here? The guideline is about use of gloves. It informs the reader about. So what do we need to find out here? Come on, tell me.
About what?
About what? Yes. So the guideline also we need to figure out the guideline on the use of gloves informs the reader. What does it inform the reader? Okay, one second. Sorry. What does the guideline on? What does the guideline on the use of gloves inform the reader? So it informs something to the reader. What is it? What does the guideline on the use of gloves inform the reader? Inform the reader. All of you take a second, go through the question, look at the interpretation. So the guideline that is focused on usage of gloves informs the reader about something. What is that? Okay. All right. So take 55 seconds, go through the extract. All of you. Okay, Leslie, can you read the heading until here for me, please?
Guideline for nurses. Use a sterile and non-sterile gloves. Gloves are not a substitute for hand hygiene and should only be used when appropriate. Their prolonged and unnecessary use may cause adverse reactions, skin sensitivity, and cross-contamination of the patient environment. Routine use is expected when anticipating contact with bodily fluids or chemical hazards and when handling sharps or contaminated devices.
So this is a guideline for nurses about the usage of sterile and non-sterile gloves. The first sentence says that okay, gloves are not a substitute for hand hygiene and should only be used when. So gloves are not something that you use instead of maintaining hand hygiene. So they are saying gloves are not a substitute. Okay, and you can only use it when it's appropriate, which means hand hygiene is important. Gloves are not something that can take the place of hand hygiene. It is something that you need to use only when it's appropriate. If you're using it for a long time or unwantedly or unnecessarily, that may lead to adverse reactions and skin sensitivity, cross contamination of the patient environment, all these things. And routine usage of gloves is expected. When you are expecting you need to routinely use gloves when you're expecting to use them, or when you're expecting contact with bodily fluids or chemical hazards, or when you're handling sharps or contaminated devices. Okay, so they are saying hand hygiene, gloves does not replace hand hygiene. They can only be used when it's appropriate, and if you use it for unwantedly for a long period of time, it can cause a lot of problems. And routinely you need to routinely use it if you expect to deal with bodily fluids or chemicals, or when you're handling sharps or contaminated devices. Okay, next sentence, Blessing.
It may also be required as part of local policy for managing transmission-based precautions, droplet, airborne, or contact.
Also, it can also be the usage of gloves can also be can also be a requirement based on the local policy, local rules for managing transmission based precautions. So when you're trying to prevent the transmission of certain droplets or airborne problems or contact related diseases, at that time, based on the local policy, you are required to use gloves at times. Okay, all right. Next, entire paragraph, Blessing, from here to here.
When undertaking an antiseptic non-touch technique, sterile or non-sterile gloves should be selected in line with the procedure and local policy. Any cuts or abrasions should be covered using a waterproof dressing before putting gloves on, and hands must be thoroughly decontaminated after removal.
Okay, when you're dealing with aseptic non-touch technique, you can use sterile or non-sterile gloves according to the procedure. In line with means according to the procedure and the local policy, according to the procedure and the rules and regulations. If you have any cut or scratch on your arm before you use on your hands, before you use gloves, you need to cover that scratch or abrasion with a waterproof dressing, and after the use, you need to thoroughly decontaminate your hands. Okay. Last sentence, Blessing.
They are a single-use item and must therefore be disposed of immediately after the care activity for which they have been worn.
So gloves are something that can only be used once. So after use, you need to dispose them off immediately. After whatever activity that you have undertaken, once that's over, you need to dispose them off immediately, because they are only for single time use. So this whole thing is about gloves, how it's not a substitute for hand hygiene and only used when it's appropriate. If you use it for long and unwantedly, it can lead to adverse reaction. If you are expecting to deal with bodily fluids or chemical hazards or handling sharps or contaminated devices, you are supposed to use it routinely. And sometimes, in order to prevent droplet or airborne or contact-based transmission, you may, as part of a local policy, you may need to be using gloves. And if you're undertaking aseptic non-touch technique, then you should wear a sterile or non-sterile gloves according to the procedure and the policy. If you have any cuts or abrasion on your hands, you need to cover it, then we use the gloves, and once you are removing the gloves, you need to decontaminate your hands as well. Then finally, gloves are a single use item, and once you have used it, you need to dispose it off immediately. Okay, now let's have a look at the options. Let's see, this is an incomplete question. Can you read each option with the question for me, please?
The guideline about the use of gloves informs the reader about when they should be worn.
Does the guideline tell us when they refer to the gloves? They refer to the gloves. So does the guideline inform us when they should be worn, when the gloves should be worn? What do you guess? Maybe. Next option, Blessing.
The guideline about the use of gloves informs the reader about why regional protocols vary.
Have they vary means change? Have they talked about the change in regional protocols?
No.
They have talked about local policy twice, but they have not talked about change in local policy. So B is not the answer. Next one, Blessing.
The guideline about the use of gloves informs the reader about how to take them off safely.
Have they explained how to take the gloves off? How to take it off safely? Have they explained that? Informed us that?
No.
They've told you need to remove them safely, immediately dispose it off. But how to do that? They have not told us. So what is the answer?
Option A.
Option. The whole first paragraph that says when we need to use it. All these things. When exactly should you use gloves? So all of you take a second, go through the question, go through the extract, go through the option. I'm moving on to the fifth question. Smita, can you unmute yourself and read the fifth question for me, please?
Yes, ma'am. What does the guidelines say about prescribing antipsychotics to patients with dementia?
So what do we need to figure out? What is mentioned about?
And what does the guidelines say about prescribing antipsychotics to patients with dementia?
So we need to read the guideline and we need to figure out what is mentioned about or what is said about prescription of antipsychotic to dementia patients. Prescription of antipsychotics to dementia patients. Okay, psychotic to dementia patients. Right. What exactly have they said in the guideline about prescribing antipsychotics to dementia patients? So all of you take 55 seconds, go through the extract. Do not look at the options, go through the extract. Okay, all right. Smita, can you unmute yourself and read till here for me, please?
Old heading, prescribing guidelines, Alzheimer's. Although antipsychotics are sometimes prescribed for behavioral and psychological symptoms of dementia, they produce limited benefits and are associated with an increased risk of stroke and mortality, as well as other serious adverse events such as sedation and accelerated cognitive decline.
Accelerated means quick. When something is accelerated, it happens really fast. Okay, when we say accelerated, we mean quick or fast. Okay, let's have a look at the sentence. So the guidelines is about prescribing for Alzheimer's, and first sentence says that even though antipsychotics are helpful for managing behavioral and psychological symptoms of dementia patients, these antipsychotics lead to limited benefit. The benefits are very limited, very less, and they also have are connections to increased risk of stroke and death. Also, it also leads to serious adverse events such as sedation and accelerates or lead to fastened cognitive decline in the mental capacity. So even though antipsychotics are good to deal with behavioral and psychological symptoms in dementia patients, and it only has limited benefits, and it's related to, it can increase the risk of stroke and mortality, and it can also cause negative events such as sedation or accelerate cognitive decline, reduction in mental capacity. It can fasten it. Okay, all right. Next sentence till here, Smita. Till here.
However, in case of dementia associated with extreme disturbance that require urgent treatment, for example, if violence, aggression, or severe agitation are present, an antipsychotic drug or benzodiazepine may be given as a last resort.
Okay, my question is, what is the last resort? What do I mean by last resort? This is a very common vocabulary. You need to know the meaning. Last resort. What do I say that? What do we mean by that? Last there, yes, correct. There was no other choice. That was the only last measure left. That was the only thing we could do. So when we say last resort, that means only thing we could do. Only thing that we could do considering the circumstances. Okay, so whenever you say, treating her problem, I mean, giving her starting insulin was the last resort, means there was no other option. Starting insulin was the only option. So that's what we mean by last resort. So this sentence says that. So they have talked about how bad antipsychotics can be, what are the negative effects, and they say that even though that is the case, in scenarios where dementia is connected to extreme disturbance such as violence, aggression, or severe agitation, in that cases, and those symptoms require urgent treatment, then you can treat the patient with antipsychotic drug or benzodiazepine as a last resort. There is no other way to control these symptoms other than antipsychotic. In such a situation, you can give them these medications. Okay, all right. Next, till next two sentences till here, Smita.
Before commencing, the benefits and harms should be discussed with the patient, family members, and carers as appropriate. The antipsychotics should be used at the lowest dose for the shortest possible time. It should be stopped if it is not helping or is no longer needed.
So they told that these can be the benefits are very few. It can cause sedation, accelerates the cognitive decline, increase risk of stroke and mortality. However, if the patient has some extreme symptoms like violence, aggression, and there is no other option, then you can give antipsychotic drug. And before you start the drug, you need to clearly explain and discuss the benefits and the positives and negatives with the patient, with the family members, and the patient's carers as needed. And the drug should only be used at the lowest dose. When you give, it should only be the lowest dose for the shortest amount of time. Not for a long period, not for a certain very little dose, for a very little amount of time. And if the medication is not helping the patient or it's no longer needed, you need to stop giving it. Okay, so all of you take a second, go through the extract. Okay, we needed to find out what does the guideline say about prescribing antipsychotics to patients with dementia. Smita, can you read the options one by one?
It is only appropriate if used for a clearly defined period of time.
Have they said that it refers to antipsychotics, right? Prescribing antipsychotics. So prescribing antipsychotics is only appropriate if used for a clearly defined period of time. Have they said that it is only appropriate for a clearly definite amount of time? Have they said that, Smita? Saubhagya, Jyoti? No.
No.
Okay. They have said shortest time, but they have here the option is given defined period of time. That's specific. No, that's not said. They have just said shortest period of time. They haven't specified it. So A is not the answer. Next option, Smita.
It is worth considering as long as patient has no comorbidities.
Have they mentioned about comorbidities anywhere?
No,
No.
ma'am.
No. Okay.
No,
All right. So of course, option C is the answer based on elimination. Smita, can you read option C for me, please?
It can be done if circumstances are so severe that there is no alternative.
Right? Last resort, right? It can be done
Yes.
if circumstances are so severe that there is no other option. That is the only thing that we could do as a last resort. So that's why C is the answer. Okay. All right. So this is pretty straightforward. Very good extract. Very good question as well. Let's move on to the final question for today. And yes. Okay. All right. Jyoti, can you read the final question for me, please? This one. Sorry, 1 second, sorry. The question, not this one question. This one.
What does the guideline say is true in the majority of cases of out-tuning?
Out-towing. So all of you read the
Out-towing.
question. What does the guideline say is true in the majority of cases of out-towing? So what do we need to find out here? According to the guidelines, what we need to find out what? What do we need to find out? Come on, tell me. What do we need to find out here?
The majority of cases.
True about. So a true fact about, or truth about basically. Truth about majority of cases of out-towing. Truth about majority of out-towing cases. Okay, so out-towing is a problem. So about that, what is true? Okay, so truth about majority of out-towing cases. Okay, all right. All of you take 55 seconds, read the extract. Okay, Jyoti, can you read the heading until here for me, please?
Okay, ma'am. Guidance out-towing in young children. Out-towing is when the toes point in outwards direction while walking and is most commonly seen in early walkers, although it It may also be associated with knock, knees, and flat foot. Restricted internal rotation of the hip is the most common cause.
So here they are talking about a problem called out-toeing, which is common among young children. So this is a condition where the toes of the feet among young children is pointed outwards when they're walking, and it is commonly seen among kids who walk early walkers who walk earlier than expected. Okay. So usually this condition is associated with knock knees or having flat foot. Even though that is the case, restricted internal rotation of the hip, if the hip is not, the rotation of the hip is restricted, that can also be the most common cause. Even though there are other causes, most common cause is usually restricted internal rotation of the hip. Okay, all right, continue, Jyoti, till here.
Serious underlying causes such as slipped upper femoral epiphysis should be excluded before parents can be reassured that is most intense. The issue corrects itself as the child grows and intervention is not usually necessary.
So I want all of you to focus on that sentence. It's a very good sentence. Serious underlying causes. So serious causes such as having a slipped upper femoral epiphysis. Serious causes such as these should be excluded, should be rejected, or should be eliminated. So you need to eliminate serious causes such as having slipped upper femoral epiphysis before you reassure the parents in most of the cases by saying that the issue will correct itself as the child grows and you don't need to, usually treatment is not necessary. So before you reassure the parents in most of the situations by saying this, okay, that the issue corrects itself and intervention is not necessary, before you do that, you need to eliminate that there is a serious cause such as slipped upper femoral epiphysis is not the case. Okay, all right. Now, Jyoti, can you read till here for me, please?
It through observation of the gait should be carried out. Then the child placed in prone position for an examination and range of motion in the internal and external hip, foot posture, and thigh foot angle, which should not exceed 30 to 40 degrees.
So the gait, gait is how they walk. Okay, so thoroughly you need to observe the how the kid walks. Then the child placed in prone position for an examination of. So then you need to place the child in a prone position and examine their range of motion in the external and internal hip, the posture of their feet, and the angle of the thigh and foot. The angle should not exceed 30 to 40 degrees. So all these things you need to monitor or you need to check. Last sentence, Judy.
Children who are showing signs and asymmetrical deformity, functional difficulties, or progression of outdoing should be referred immediately.
So if you have kids who are showing signs of asymmetrical deformity, functional difficulties, or the outgoing is advancing, then they need to be referred to doctors immediately. Okay, so they talk about what is outgoing, and how it is found in kids who are early walkers. Although knock knees and flat foot can be reasons, the most common cause is restricted internal rotation of the hip. Once you exclude serious causes such as a slipped upper femoral epiphysis, you can reassure the parents in most of the cases by saying that the issue corrects on its own and you don't need any treatment. Then you need to thoroughly observe the walking, how the kid walks, and you need to keep the child in a prone position and examine their range of motion, internal and external hip, and you need to check the foot posture and the thigh foot angle, which shouldn't exceed 30 to 40 degrees. And if kids are showing any signs such as these, they need to be referred to doctor immediately. All of you take a second, go through it. Okay, now let's have a look at the options. So Jyoti, can you read the options one by one for me, please? We need to find out among these three what is true. Okay, Jyoti, can you read A, B, C options one by one? Okay, all right. So yeah, so option A say that both feet are affected to similar degree. Have they said that both feet are affected in the same manner? Anywhere?
No.
No, so we can reject option A. Let's have a look at option B. The problem will resolve naturally over time. Is that true? What do you guys think? Is that true?
Yes.
Yes, it can be. But let's have a look at option C as well. It's not possible. It's not possible to identify the underlying cause. Have they said that it's not possible? No, actually they have given a lot of causes, right? So
Yes.
C is not the answer. Option B is the answer. Okay, so all of you take a second. So it's not possible. They have given the most common cause. They have also given other rare causes. So you cannot say that it is not possible. Actually, it's possible. So option B is the answer. This sentence. The issue corrects itself. Okay, so all of you go through the last question. All of you. Right. So that's it for part B. So today, the material that we did is the latest material that was published this year. So please go through that. I'll be sending you this material and I'll be sending you one extra material in both groups. Okay. Please go through it. If you have any questions, feel free to ask. These are very good questions and the extracts are really good. So please go through it and please go through all the questions once again. And if you have any questions, get back to me. Tomorrow morning, I'll be conducting reading part C. Again, we will be using a very new material. Okay, all right. So that's it for now. Any questions before I wrap up? Okay, perfect. So thank you for joining. I'll see you guys tomorrow. Tomorrow morning, morning it will be reading part C. Evening it will be listening part A. So reading part C and listening, I'll be using new materials. Okay, all right. So I'll see you guys tomorrow. Okay, all right. Thank you.
Thank you, ma'am.